So how do you see the digitalization playing out? This has been a long-standing, important topic, but now in the future of health policy in Europe, how do you see that?
When we spoke about the demographic change and the aging of the population, digitalization is one of the innovative solutions. Actually, digital has been at the center now past few years, because both the member states as well as the Commission have been keen on working on it. We have several good models in Europe, but what is very encouraging is that in Germany, Minister Jens Spahn has started a real drive towards digitalization in Germany, the biggest economy in Europe. Minister Spahn and President von der Leyen, they published a joint letter on the need to find a way for data handling in Europe, which is the European way. And it is likely now that this new way of data handling will be encompassed in the European health data space, a proposal from the new Commission. In this new European health data space, we will be creating possibilities for data movement across Europe. Legislation, but also practical mechanisms like the e-prescriptions exchange. If we can get into the situation where the health data, like the genomic data and other health data, is moving across Europe, then that provides many new opportunities, like on real-world evidence. Real-world data is collected in healthcare all the time, and by combining evidence from different countries, we could come up with valuable assessment of innovative new products or services, medicines or from medical devices.
If you had one key message to look at how to really move the dial on policy over the next 5 years, what advice would you give in terms of health and life sciences policy?
European health policy making is always a lively area, and sometimes you feel that it is difficult to move ahead. But what I have found is that when there's a will, there's a way. I cannot emphasize too much the value of stakeholders in this process, not only the governments, but all the stakeholders from patients to clinicians to industry, working together so that the paradigm shifts, like the economy of well-being, real-world evidence, or value for health, they are understood by different stakeholders, and then that can create European policies.